So today it's an honour to be talking to Mr. Prakash, the well-known Harley Street surgeon. How are you today?
I'm fine, thank you, Stephen. How are you?
Well, it's great, but it's been a really difficult year for absolutely everybody. It's 2020 will go down as the year of difficult years, won't it?
Yes, right.
I know a lot of people are asking me, I write about beauty and I'm a beauty expert, is it safe to go back in and have your Botox, your fillers done? Is it COVID friendly in the clinics?
I think if the clinic has been well maintained by COVID restrictions, whatever the precautions we need to take, and the most important thing that I like to make it very simple, one is self-protection, second is the family protection, and the third is the social protections.
Okay,
right?
so if I can ask you there, you said social protection. What would you suggest to a client coming here she does to prepare for a trip to the clinic to make herself protected?
Most important thing, she should not have any symptoms of COVID, or she should be fit enough to travel. And then she has to take the precautions of mask plus social distancing. This is called social protections, like sort of thing. And then the family protections, if any of the family has any symptoms, then they have to isolate themselves, and plus that, and taking appropriate precautions and measurements of.
I know that people get a bit confused because you just said there any symptoms. What are the symptoms that you'd be looking for?
Commonly they say fever, high fever, and then chest infections like cough and cold, a persistent cough with phlegms. And the third thing they say, the absence of smell and taste. And then the body aches and the breathing troubles, like mostly commonly the COVID goes into the lungs and gives the lung the congestion, make them difficulty in breathing.
Yeah, we understand that. So now the big question is, when you come to your clinic, right? I know people are asking me, how do you know it's safe to go into the clinic? What precautions are you taking within your clinic to make sure it's COVID friendly?
The first thing is we take the temperature.
Well, not COVID friendly, sorry, I should say, yeah.
The first thing is taking temperature first to make sure they are not having any fever.
Yeah.
And second, they make a hand wash to wash their hands properly before they come in, and make sure they have the mask. Those are the important things that we need to make sure we do that, and also the distancing. Unless they do have any examinations very near to that, keep the good 3 feet or a meter distance. This would be ideal.
So you would say it'd be safe for people to come back and have the Botox, the fillers. It's safe to come back, is it?
I think if they are healthy and if our atmosphere is well protected and I am healthy, yes.
But you're also offering clients consultations by Zoom, aren't you?
Yes, we do a lot nowadays.
We do that. And is that as good as coming in to see you?
I think it's nothing equivalent to coming to face-to-face consultation, because Zoom consultation, one, the communication will not be that closer. Second, the examination is not really good. So it is just an alternative at this situation, but I would not go, if you ask me what is the best preference, face-to-face consultation, always good.
Well, another question, you're offering vitamin drips here and like vitamin B and things. Are those beneficial to help fight against things like COVID, do you feel?
I think in my experience and others' experience, the first thing is the self-immunity protection is most vital. Yeah. You know, if you don't have your fortress is well protected, and whatever they like to come inside you, like always compare, is your house is well protected.
Yes.
With a good wall, good alarm, good systems of everything, with a good dog, a good watch, people security, then now nobody can enter. But if your immunity is very low, not taking enough good nutritious immune food, and then taking a good stress management, having heavy stress, that also reduces the immunity. Plus not taking enough sleep in the right time, in the right long time, durations, quality of sleep. And plus not taking enough vitamins, minerals, especially the good vitamins like vitamin D3, vitamin C, zinc.
So I was going to ask you, if you came in and had a vitamin D drip or a shot, would that help? Would it be beneficial?
Usually vitamin D is not in drip. They are always comes in either drops or in capsules. They don't come in IV. The vitamin C is the one that comes in IV, and also other drips. Like multivitamins, B complexes and other things.
So basically you can ring up, make an appointment here and feel safe coming in.
Absolutely,
Oh,
because we make sure our premises are safe and we are safe.
Oh, that's fantastic.
And when they come in, they are safe too.
Great. Thank you ever so much. Thank you, Dr. Specialist. Lovely meeting you.
Thank you.